Hello, family and friends. On day one of our discussion about colorectal cancer a couple of weeks ago, we learned that it is the second deadliest cancer in the United States. The good news is that screening can save lives by detecting cancer early, by finding and removing polyps before they turn into cancer. Polyps are growths in the colon that can take 10 to 15 years to develop into cancer. They are often small and don't cause symptoms, which is why screening is so important. So, who should be screened? Most major medical organizations now recommend that people with an average risk of developing colorectal cancer should be screened starting at age 45. And what is average risk for colorectal cancer? Your risk level is considered average if you have no history of colorectal cancer or polyps, no family history of colorectal cancer, no history of Crohn's disease or ulcerative colitis, no history of or suspected history of hereditary cancer syndrome, no history of previous cancer treatment to the pelvic or abdomen region. However, you may have an increased risk if you or a close relative had polyps or cancer previously, you have ulcerative colitis or Crohn's disease, your family has a history of a hereditary cancer syndrome, you've had cancer with radiation to the abdomen or pelvic area. Let's now look at screening guidelines according to age. The guidelines are determined by age and the time it typically takes for a polyp to develop into cancer. Ages 45 to 75, colonoscopy is recommended every 10 years for the average risk patient. If, however, you are not at an average risk, then speak with your primary care provider to determine when to start screening and at what frequency based upon your individual risk factors. For ages 76 to 85, testing is based on an individual basis, and factors such as overall health, life expectancy, and previous screening history are taken into account. For ages 85 and over, testing is not recommended. So, what are the options for screening tests? Number one, the colonoscopy is the gold standard because it's both diagnostic and therapeutic. It can both diagnose and remove polyps at the same time. During a colonoscopy exam, a long flexible tube called a colonoscope is inserted into the rectum. A tiny video camera at the tip of the tube allows the doctor to detect changes or abnormalities inside the entire colon. It takes about 30 to 60 minutes, and screening is generally repeated every 10 years if no abnormalities are found and if you don't have an increased risk of colon cancer. Number two, the Cologuard test, which is a stool-based option. You've probably seen the Cologuard commercials. It is a stool DNA test that uses a stool sample to look for signs of colon cancer. The test checks for changes in the cell's genetic material or abnormal DNA. Certain DNA changes are a sign that cancer is present or that it might happen in the future. The stool DNA test also looks for hidden blood in the stool. So who can use the Cologuard test? This test is meant for people who have an average risk and who have no symptoms. If you are considered at an increased risk for colon cancer due to your family history, genetic mutations, or other risk factors, or you have symptoms, then you are not eligible for the Cologuard test. Let's now look at Cologuard test results. The Cologuard test results come back as either positive or negative. If the test comes back negative, this means no abnormal DNA or blood was found in your stool, and it is recommended to repeat the test every 3 years. However, the test misses about 7% of cancers and it misses about 57% of precancerous polyps, which means your test came back negative when cancer or polyps were actually present. If the test comes back positive, this means the test identified possible colon cancer or precancerous polyps. However, there is approximately a 10 to 15% chance of a false positive, which means your test came back positive when no cancer or advanced polyps were actually present. If you have a positive test, the next step is to get a colonoscopy as soon as possible and no later than within 9 months. Let's end by looking at the advantages and disadvantages of both tests. First, what are the advantages of the colonoscopy? Well, doctors can visualize the entire colon directly. They can remove polyps during the same procedure. It only needs to be done every 10 years if it's normal. And what are the disadvantages of the colonoscopy? First, it requires bowel preparation. It requires sedation and someone to drive you home. There's also a small risk of complications. Bleeding occurs in about 15 per 10,000 procedures, and perforation occurs in about 3 per 10,000 procedures. These risks increase with age, particularly in people over the age of 75. And in general, it's more invasive. Now, let's look at the Cologuard advantages. It doesn't require sedation or bowel preparation. It's not invasive. It can be done at home. It's considerably less expensive, and there are no dietary restrictions. Lastly, what are the disadvantages of the Cologuard? It has a much lower sensitivity for precancerous polyps. It only detects about 43% of these precancerous polyps, missing 57%. It requires repeat testing every 3 years compared to 10 years for the colonoscopy. Any positive results requires a follow-up colonoscopy anyway. So my final thoughts are, with colon cancer on the rise, it is imperative to get tested by one of these methods. If you have been putting off a colonoscopy because you're apprehensive about having a procedure, consider getting the Cologuard test, but understand its limitations, particularly its much lower ability to detect precancerous polyps, missing more than half of them. The most important thing is to get screened. Speak with your doctor sooner than later to determine the best option for you based upon your age, risk factors, and personal preferences. Well, that's it for today.